Hi, this lecture is about milieu therapy. So, milieu therapy is when the mental health nurse provides structure, maintains a safe, therapeutic, recovery oriented environment in collaboration with healthcare consumers, families, and other healthcare clinicians. So, we have to make sure that patients understand their rights, their responsibilities, that they receive culturally competent care and structure, safety, and we limit set on the unit as well. We, as a nurse, we set up individual as well as group activities, and we make sure that we meet the patient's physical as well as their mental health needs. So the nurse is the one that's primarily in charge with those physical needs. And we always want to make sure that we have the least restrictive environment. Um, we do want to make sure that we look at the patient's social skills in the context of their interactions. So, what that means is that the nurse will dissect some of those things as he or she sees them. So, if there are some conflict going on in the day area, or there is a discussion that a patient is having, and it seems like they're struggling through some of those social interactions, that we would actually pull that person aside and kind of dissect what is going on at the time so that they can receive feedback and information about the way that their interactions are maybe affecting their ability to develop relationships with other people, or the way that some of their communication is interfering with the way that they're able to get their message across to others as well. So, um, as far as notes go, you want to add that socialization and relationship awareness are important, and that we pull people aside in order to have these discussions. So other roles of the nurse takes on a lot of different roles. We are the ones that provide that around the clock care. We meet the physiological needs, as I said. We administer medications. We do one-to-one interactions. We set limits with consequences. We never want to set a limit and not have a consequence that goes along with it. So we want to make sure we're doing that. We teach, and we do a lot of reality orientation. So some things that we might see in a psychiatric setting that would indicate that the environment is not very therapeutic. So we want to think about, what do those patients need? Well, they need structure. So if we're seeing a lot of unstructured downtime, patients just watching TV all the time, not interacting with any of the staff members, hardly at all, they're extremely bored. Those types of things would indicate that it's not therapeutic. So we want to make sure that we are watching for those things and thinking about those things. That can actually be a good way to think about quality improvement. If you see areas where the environment maybe isn't as therapeutic as it could be, then go ahead and those are things that you can write about as far as quality improvement issues. So basic elements of a therapeutic environment. So there's some things that we really should see. Of course, safety. So safety is pretty self-explanatory. It's just keeping that environment safe. So it's what we see in the rounding. It's what we see in the gathering of the patient belongings, and going through all of those, ensuring that there isn't anything safe with the patient or the environment. Structured, or having those structured activities throughout the day. And we see that a lot with the schedule. So the schedules that are hanging, or the schedules that the patients get upon admission, that really indicates that they're that they have specific things that they need to do, and that they're aware of what those things are. Norms. So norms is something that is actually determined by the patients. So we have day-to-day norms all the time, and those are really determined by our peers. So what that means is it's really what is and is not acceptable in the current environment. And so sometimes I may see this in patients when I've had a patient who's come up and who's been extremely rude and maybe cussing at me or something, and then I'll have another patient say, "That's our nurse. We don't talk to her that way." And so it's actually it's similar to limit setting, but that it's enforced by the peers. So that's the important piece there, that it's determined by the peers. Limit setting, again, is similar, but it's done by the staff. So it's where we determine what is acceptable and not acceptable behavior. And so um, you may have patients that are getting a little too close in group, or walking the halls and trying to hold hands, things like that. And so as a staff member, we would go up and tell them, that touching is not allowed. And we would set that limit and then potentially tell them that they might have to be separated if it continues, because that would be the consequence. Balance. This is the hard one, especially for students. So balance is learning when to bend or break a rule. Now, we have rules for a reason, but as always, rules have to be broken on occasion. So an example of this is that all of the day areas are closed down and the phones are turned off when it's time for group, so that patients are encouraged to go to group without any other distractions. But I have had patients who had family members who were overseas, especially during wartime. And I've pulled them out of group, I've turned the phones on and let them talk to that person. Now, it's a little bit tricky, and I believe that was the right thing to do, was to break that rule for that individual. However, now I have other patients saying, well, why can they be on the phone when I'm not allowed? And you can't share that information. I can't say, oh, they have a family member overseas. Now the patient may say that, but as the nurse, I can't divulge that information. So I just have to tell them that I make the best decisions that I can for each situation, and that it was a unique situation. And that's about the best that you can do sometimes, and it does cause a little grief anytime you break the rules. So you have to keep that in mind, that there's always consequences to breaking those rules. Okay, so I want you to take a moment and read which element. So the first one's about John. So I'll give you a moment so you can pause it and you can read that and take a guess. Which element do you think it is? Is it safety, structure, norms, limit setting, or balance? And I will tell you that each of these are gonna appear like they're more than one, but you have to pick which one's the primary one. Okay, I'm gonna answer, so pause it if you don't wanna hear yet. This one is safety. The next one, Mary. So again, go ahead and read that. And then I am going to answer now. That one is limit setting. So let's talk about why. The first one is safety, because the biggest thing the nurse is doing is intervening and firmly redirecting to his room, so taking him out of that situation. The next one is limit setting, because they are deciding just to meet with her once every 4 hours for a 15-minute setting. They're putting limits on that behavior that they have determined is probably detrimental to her. Okay, research on milieu. So the last part here. So research has shown that hospitalized patients indicated the 4 following themes with their experience of being on an inpatient unit. So they looked at refuge from self-destructive behavior. So they feel like the hospital is really contrasted with the outside world, that it's a safe house, a neutral territory, or a cooling down place. And so as you interact with patients, you can see that it is very different from their home environment, and it does give them some time to feel a little bit better, to be away from the stressors that are maybe triggering some of the mental health issues that they're having. like me, not like me, they a lot of patients will say that they finally see that other people do experience some of the same things that they do, and they feel a little bit relieved. They kind of felt isolated before. So when they're hospitalized and they go to groups and things, they actually see that yes, they're not the only ones that experience these types of thoughts or feelings. Possibilities, no possibilities. So they tend to be more open about the possibilities of the future. And so um, one of the items that they may get from a group is to get hope, to feel hope about the future when they see people who are further along than they are. So maybe it's in abstaining from alcohol or drugs, maybe it's just in depression and recovery, maybe it's in relationships and repairing things, but they can talk to others and see that yes, they can do this as well. And it gives them hope about the future, hope that they may not have had before. Now, one thing to note about the possibilities, no possibilities, is that even though we work with patients to determine their goals and determine a plan on how to reach those goals, sometimes they still fear being released because then they have to implement those things. And that can be a really scary type of situation. They also will feel connect or disconnect. So the patients have said that they often, what they feel is they feel a connection to other people, to other patients, but unfortunately they feel disconnected from the staff. And I do believe that we can do a better job. I also believe that there's a whole heck of a lot of paperwork and things that you have to do on each patient. And that makes it very hard to go and interact with your patients when, you don't have documentation in the room, when all the documentation has to be done behind the nurse's desk and you have page after page after page to do on each patient. But I do think that we can make more of an effort, and I hope that you guys will be part of that effort in interacting with our mental health clients.